السلام عليكم ورحمة الله، مرحبا بكم مجددا في محاضرة جديدة من سلسلة محاضراتنا عن مراجعة أسئلة اختبارات البرومتريك Review of Prometric Test Question. This is lecture number 2 in acid-base balance. Today we are going to discuss 13 questions from question number 12 up to question number 24. معكم محمد عثمان يحيى. نبدأ مباشرة. Question number 12. Ringer lactate considered as which type of IV solution? The options are number A, hypotonic, number B, hypertonic, number C, isotonic, number D, hyperalimentation. وقف الفيديو هنا واختار الخيار شوف صحيح. The correct option is option number C. ليه اخترنا الخيار رقم C؟ نشوف rational. Lactate ringers is isotonic solution because it contains an electrolyte balance similar to plasma in the bloodstream or concentration similar to plasma. يعني تركيز تبعه نفس تركيز الدم أو البلازما، عشان كده بنسميها isotonic. Common example of isotonic solution are 0.9% normal saline and lactate ringer. دي أمثلة بالنسبة لي. So ringer lactate is isotonic solution, which is the correct option. Question number 13. A nurse reviewed a chart of a 42-year-old man whose ABG analysis report is shown pH 7.20, PaCO2 35, HCO3 20. Which of the following is the most likely interpretation of the findings in the report? The options are number A, respiratory alkalosis, number B, metabolic alkalosis, number C, respiratory acidosis, number D, metabolic acidosis. وقف الفيديو هنا واختار الخيار اللي بتشوفه الصحيح بناء على تفسيرك لنتائج ال ABG. The correct option is option number D, which is metabolic acidosis. ليه اخترنا الخيار رقم دي؟ نشوف rational. عندنا الريفرنس رينج موجودة جاهزة. طيب. The patient pH is 7.20. It means there is acidosis. ليه؟ لأنه أقل من 7.35. The patient HCO3 هو البايكارب is 20 غير طبيعي أقل. The patient PaCO2 ثاني أكسيد الكربون 35 طبيعي، لأنه طبيعي من 35 إلى 45. طيب عندنا القانون بيقول الآتي: if HCO3 البايكارب كانت abnormal and PaCO2 ثاني أكسيد الكربون normal، توالي نقول المشكلة ميتابوليك. ليه؟ لأنه الخلل في ال HCO3 اللي هو البايكارب، والبايكارب regulated by kidney، فبالتالي الموضوع ميتابوليك. طيب وإذا كانت if PaCO2 abnormal ثاني أكسيد الكربون كانت غير طبيعية وال HCO3 normal، توالي نقول المشكلة respiratory condition. ليه؟ لأنه ثاني أكسيد الكربون regulated by respiratory system. فبالتالي يا أخوانا الحالة تبعنا so the patient condition is metabolic acidosis. ليه metabolic؟ لأنه الخلل في HCO3. وليه acidosis؟ لأنه ال pH هنا أقل من 7.35. ودي أخوانا ال correct option. طيب. Question number 14. Physician orders an intravenous fluid of D5NS at 100 cc per hour. This is an example of which of the solution? The options are hyperalimentation, number B, hypertonic, number C, hypotonic, number D, isotonic. وقف الفيديو هنا واختار الخيار بالشوف الصحيح بناء على معلوماتك عن ال D5NS. The correct option is option number B, which is hypertonic. ليه اخترنا الخيار رقم B؟ نشوف rational. D5NS is hypertonic solution. ليه؟ because it has a higher concentrations of electrolyte than plasma. تركيزه أعلى من تركيز الدم. Common example of hypertonic solutions are dextrose 5 in 0.9 normal saline اللي هو D5 NS and D5 in lactate ringers. ديل أمثلة ل hypertonic solution. So D5 NS is hypertonic solution which is the correct option. ده خيار بتاعنا اللي هو hypertonic solution. طيب. Question number 15. 13-year-old patient is admitted for diarrhea and vomiting. He looks pale and lethargic. The blood pressure is 110/70 mmHg, heart rate 76 beats per minute, respiratory rate 18 breaths per minute, and temperature of 36.1 centigrade. A nurse is preparing to give IV hypotonic solution. Which IV solution is most appropriate? The options are number A, 0.9% saline, number B, lactate ringers, number C, 10% dextrose in water, number D, 0.45% sodium chloride. وقف الفيديو هنا واختار الخيار اللي تشوف الصحيح. The correct option is option number D, which is 0.45% sodium chloride. ليه اخترنا الخيار رقم D؟ نشوف rational. 0.45% sodium chloride is hypotonic solution. ليه هي hypotonic? Because it has concentration of dissolved particles lower compared to the plasma. So the correct option is option number D. 0.9 saline and lactate ringer, they are isotonic solution. تركيزها نفس تركيز البلازما أو الدم. And 10% dextrose in water is hypertonic solution. تركيزها أعلى من تركيز الدم. فبالتالي قلنا the correct option is option number D. Question number 16. A client who experienced a myocardial infarction is being monitored via cardiac telemetry. The nurse notes the sudden onset of this cardiac rhythm on the monitor and immediately takes which action? The options are number A, takes the client's blood pressure. Number B, initiates cardiopulmonary resuscitation, CPR. Number C, places a nitroglycerin tablet under the client's tongue. Number D, continues to monitor the client and then contacts the healthcare provider, HCP. وقف الفيديو هنا واختار الخيار اللي بتشوفه الصحيح. The correct option is option number B, initiate cardiopulmonary resuscitation. ليه اخترنا الخيار رقم B؟ نشوف rational. Identify the cardiac rhythm first and then determine the priority. طيب. This cardiac rhythm is ventricular fibrillation. دي اللي هو VF. طيب. The goal of treatment are to treat VF properly and to convert it to unorganized rhythm. These goals achieved by immediately defibrillate the client. If defibrillator is not available, CPR is initiated until the defibrillator arrives. So, the correct option is option number B, which is initiate CPR. طيب. Option number A, C, and D are incorrect and delay life-saving treatment. So, the correct option is option number B. Question number 17. A nurse is performing cardiopulmonary resuscitation, CPR, on an adult client. When performing chest compression, the nurse understands that correct hand placement is located over the options are lower third of the sternum. Number B, upper half of the sternum. Number C, upper third of the sternum. Number D, lower half of the sternum. وقف الفيديو هنا واختار الخيار اللي بشوفه. The correct option is option number D, which is lower half of the sternum. ليه اخترنا الخيار رقم D؟ نشوف rational. The correct hand placement is lower half of the sternum. This position corresponds to the center of the patient chest. بيساوي وسط صدر المريض. Placement the hand on the lower half of the sternum focuses the compressive force on the sternum. بيخلي القوة بتاعت الضغط يكون في الاسترنم نفسه. واللي بدوره بيقوم بيعمل decreases أو يقلل من chance of refraction، من فرصة إننا نكسر الضلوع أثناء عملية CPR. So the correct option is option number D, which is lower half of the patient sternum. Question number 18. A nurse is performing CPR on adult client. The nurse understands that when chest compression are performed, the sternum should be depressed. The options are number A, 3/4 inches, number B, 1 inches, number C, 2 inches, number D, 3 inches. وقف الفيديو هنا واختار الخيار بشوف سريع. The correct option is option number C, which is 2 inches. ليه اخترنا الخيار رقم C؟ نشوف rational. The sternum should be depressed to a depth of approximately 1/3 of the anterior posterior diameter of the chest. This is about 2 inches in the adult and child and 1.5 inches in the infant. So the correct option is option number C, which is 2 inches. Question number 19. You are performing CPR on an infant when a second rescue appears. What is the next step in management? The options are number A, immediately transport the patient. Number B, wait until exhausted, then switch. Number C, have the second rescue help with CPR to minimize fatigue. Number D, have the second rescue begin ventilation ratio 30:2. وقف الفيديو هنا واختار الخيار اللي بتشوفه صحيح. The correct option is option number C. Have the second rescue help with CPR to minimize fatigue. ليه اخترنا الخيار رقم C؟ نشوف rational. The ratio of 2-person CPR for infant and children is 15 compression to 2 breaths, while 1-person CPR for all ages is 30 compression to 2 breaths. So the rescue should allow the second rescue help with CPR to change the ratio from 30 compression to 2 breaths to 15 compression to 2 breaths. So the correct option is option number C, which is have the second rescue help with CPR to minimize fatigue. Question number 20. What should be your first concern at the scene where a person has been seriously burned? The options are number A, check the scenes for safety. Number B, checking the victim's breathing and pulse. Number C, calling your local emergency phone number. Number D, cooling the burned area. وقف الفيديو هنا واختار الخيار شوفوا صحيح. The correct option is option number A, which is checking the scene for safety. ليه اخترنا الخيار رقم A؟ نشوف rational. Scene safety is the first step in any emergency. It is one of the most important steps when helping someone in an emergency because you can't or you cannot help someone if you become injured or become a victim. So the correct option is option number A, which is checking the scene for safety. Question number 21. While performing cardiopulmonary resuscitation (CPR) on a 5-year-old child, the nurse palpates for a pulse. Which of the following sites is best for checking the pulse during CPR in a 5-year-old child? The options are number A, femoral artery, number B, carotid artery, number C, radial artery, number D, brachial artery. وقف الفيديو هنا واختار الخيار بالشوسة. The correct option is option number B, which is carotid artery. ليه اخترنا الخيار رقم B؟ نشوف rational. Checking the carotid artery pulse in a child during CPR provides vital information about perfusions of the brain. So the correct option is option number B, which is checking the pulse from carotid artery. Regarding to the option number A and B, the brachial and femoral pulse are checked in an infant because the infant's short and typically fat neck make it difficult to palpate the carotid pulse. And regarding to the option number C, radial artery, the radial arteries might indicate perfusion to the peripheral body side, but the carotid need is for adequate circulation to the brain. So the correct option is option number B, which is carotid artery. Question number 22. After activating the emergency call system, what should be the next immediate action, referring to the figure? The options are number A, initiate ventricular pacing, number B, administer bolus of lidocaine as prescribed, number C, defibrillate the patient, number D, open the patient's airway. وقف الفيديو هنا واختار الخيار اللي بتشوفه الصفر. The correct option is option number C, defibrillate the patient. ليه اخترنا الخيار رقم C؟ نشوف rational. First, identify the cardiac rhythm and then determine the priority nursing action. This cardiac rhythm is ventricular tachycardia. Ventricular tachycardia is characterized by the absence of P waves, wide QRS complexes, and a rate between 100 to 250 impulses per minute. The rhythm is usually regular. This is the definition of VT. Treatment of ventricular tachycardia depends on the following conditions. Number 1, stable client with sustained VT, or patient with pulse and no signs or symptoms of decreased cardiac output. هنا مباشرة نعمل الآتي: administer oxygen as prescribed and administer antidistress mix as prescribed. This is number 1. Number 2, unstable client, مريض غير مستقر with VT، بمعنى إنه with pulse and sign and symptom of decreased cardiac output، ومعه أعراض وعلامات انخفاض الناتج القلبي. في الحالة دي هنعمل إيه؟ administer oxygen and antidistress mix therapy as prescribed, in addition to prepare for synchronized cardioversion. طبعا في اختلاف بين السynchronized cardioversion والdefibrillation. طيب المرحلة الثالثة أو الحالة الثالثة اللي هو pulseless client with VT. في الحالة دي نعمل الآتي: defibrillation and CPR. Coming to the question، نرجع للسؤال. After activating the emergency call system, what should be the next immediate action؟ إحنا أصلا متى نعمل activation للemergency call system؟ بنعمل activation للemergency call system في حالة CPR، في حالة pulseless client. So معناها المريض تبعنا كان pulseless with VT. So the correct option is option number C, which is defibrillate the client. Question number 23. A nursing instructor teaches a group of students about basic life support. The instructor asks a student to identify the most appropriate location to assess the pulse of an infant under 1 year of age. Which of the following, if stated by the student, would indicate that the student understands the appropriate procedures? The options are number A, carotid, number B, popliteal, number C, radial, number D, brachial. وقف الفيديو هنا واختار الخيار تشوف صحيح. The correct option is option number D, which is brachial. ليه اخترنا الخيار رقم 2 نشوف. Rational. For an infant, it is easiest to check for a pulse using the brachial artery. ليه؟ Because the infant's short and typically fat neck makes it difficult to palpate the carotid pulse. In addition, popliteal and radial arteries pulse are also difficult to palpate. So the correct option is option number D, which is brachial. Question number 24. A nurse is viewing the cardiac monitor in a client's room and note that the client has just gone into ventricular tachycardia. The client is awake and alert and has good skin color. The nurse will prepare to do which of the following? The options are number A, immediately defibrillate. Number B, prepare for pacemaker insertion. Number C, administer amiodarone intravenously. Number D, administer epinephrine أو adrenaline intravenously. وقف الفيديو هنا واختار الخيار اللي تشوفه صحيح. The correct option is option number C, which is administer amiodarone intravenously. ليه اخترنا الخيار رقم C؟ نشوف rational. First line treatment of ventricular tachycardia in a client who is hemodynamically stable is the use of antidistressmic such as amiodarone, lidocaine, and procainamide. So the correct option is option number C, which is administer amiodarone intravenously. Regarding to the option number B, pacemaker, is used with hemodynamically unstable ventricular tachycardia. And regarding to the option number A, defibrillation, is used with pulseless ventricular tachycardia client. And regarding to the option number D, administered epinephrine, epinephrine will be stimulate and alert the excitable ventricular and is contraindicated in this case. So the correct option is option number C. شكرا جزيلا. نتقابل في محاضرة جاية. Don't forget to support us by comment, like or subscribe.